Hello, good evening. This is Dr. Samuel, your online doctor. I want to talk to you about the issue of chest pain. As a patient, you may be concerned about what's causing pain in your chest. So I want to use this video to provide information in that aspect. Pain in the chest could come from any of the tissues of the chest. It will come from the joints in the chest, from the bones in the chest, or from the line from the line of the epithelium or the body cavity of the chest, which is called the pleura, or it will come from the viscera, or the soft organs inside the chest, the heart, the lungs, or from the coverings of the heart, which is called the pericardium. So the chest will come from any tissues in the chest. Now let's talk about the more common ones, or the more prominent ones. Infection of the lung tissue, like in pneumonia, usually goes with chest pain. Okay. Yes. Then also the reduction of blood supply to the heart, we call chest pain. That's called angina pectoris. It could be stable or unstable, or it could involve death of heart tissue. That is myocardial infarction or cardiac heart attack. So that this causes very severe pain. Heart attack is associated with very severe pain. Okay. Then you can have infections in the chest, in the middle of the chest, you call it medial sinusitis. Infection in the middle of the chest. There is a space in the middle of the chest where you have the great arteries. We have the aorta, the inferior vena cava, the cystic duct, we have the thymus gland. This place can be infected, and it could be serious, and it will be pain emanating from there. Then so the pain will come from the middle of the chest, the very center of the middle of the chest, the channel in the middle of the chest. The pain could also be coming from the bones, from the lining of the chest wall. The inner surface of the chest wall is lined by a smooth material, a smooth layer, which is called a pleura. It's a slippery layer which allows the lungs to slide as you breathe in and out. When you slide, the lung moves in the chest, up and down, up and down. It slides on that layer. That layer is called a pleura. So if the layer is inflamed, it will cause pain. The pain is called pleurisy. And pleurisy pain is felt as you breathe. When you breathe out, you feel it. When you breathe in, you feel it, because the lung is irritating the point that's inflamed. Okay, so that's for the inner part of the chest. That's for the viscera of the chest. Pain could come from the ribs. Bone pain from the ribs. Like a person who has sickle cell anemia, there will be bone pain from the ribs. Or if someone has an infection of the bones of the ribs, that's called osteomyelitis. There could be pain from the bones of the ribs. There could be pain from the muscles of the chest. The several muscles. The muscles of the chest include the muscles between the ribs. They are called intercostal muscles. If the muscles are inflamed or compressed or otherwise harmed or otherwise damaged, they could be the cause of pain in the chest. The joints of the chest also cause pain. All the ribs are articulated. The ribs are all articulated to cartilage. So all the ribs from the first rib down, they are articulated to cartilage. They are joined to cartilage, and then the cartilage is now joined to the central bone in the sternum. So there's a joint between the cartilage and the sternum, and the cartilage and the rib. So each rib that goes to the sternum has two joints between the rib and the sternum. So those joints can be sort of pain. Okay? So if you have pain in your chest, you don't have to assess it properly to find the site of the pain or the source of the pain. Because there are many possible causes of chest pain. It could be from the chest wall, or it could be from this right side of the chest. It could be from the ribs, the bones of the ribs. It could be from the cartilages, through which the ribs join the sternum. It could be from the sternum, which is the central bone here. It could be from the manubrium, which is the bone that sits on top of the sternum. It could be from the joint between the manubrium and the sternum. It could be from the joint between the ribs and the spinal column at the back. It could be from the spinal column itself. So it could be from the tissues that are traversing the chest, the aorta, the esophagus, the cystic duct, the inferior vena cava, the trachea, it carries air. The pain could come from any of these structures. For example, heartburn comes from the esophagus. It's caused by acid that's running from the stomach upward in the esophagus because it causes chest pain. Aortic dissection is when the wall of when blood is chiseling within the wall of the aorta. When the blood under pressure is chiseling within the wall of the aorta and splitting it. That causes excruciating pain, like it's just a pain of heart attack. So the pain then comes from the aorta, which is traversing the chest. That is called aortic dissection. It can be a fatal situation. And so pain will come from the trachea. If you have bronchitis, when the trachea traverses the chest and passes through the neck. So if pain from the trachea, you have bronchitis, you have pain in the chest coming from the air channel that was within the chest. Okay, and as I mentioned before, you can also have pneumonia. You can also have pleurisy. You can have osteitis, which is from the bones, arthritis from the joints. Alright, so the question is, that goes to answer the question. That's an answer to answer the question, doctor, where could the pain be coming from in my chest? Now, although all of these institutions have their treatments, okay, I'll just highlight them a little bit. The pains from the bones and pains from the pain from the bone the pain from the bones can be treated with painkillers. Okay? If the body is fractured, of course, it has to go beyond painkiller because a person involved in an accident could have fractured the ribs. That will have a specific treatment. Okay, a specific treatment which is more beyond the reach of this video. For example, if many ribs are fractured at the same time, you have what we call a flayed chest, whereby the ribs are completely disconnected. The part of the chest is completely disconnected from the rest of the chest, and now moves with the changes of pressure within the chest, and don't allow the patient to breathe properly. That requires a whole set of that's the whole problem of its own. And has to be treated in a specific way. So I can't handle every cause of pain. I can't handle the treatment of every cause of pain within this video. Maybe later I will do that. Thank you very much.